Good morning, everyone. Thanks for joining us for our what employers need to know about workplace safety as the pandemic, hopefully, I like how you did that, Jim, hopefully winds down. We have got Jim Yates, a member of Eastman & Smith Ltd's Labor and Employment Practice Group and an SHRM certified senior professional who has represented employers in labor and employment matters for over 25 years. He represents employers in all facets of labor and employment law matters, including equal employment opportunity matters, collective bargaining, workers' compensation, and workplace safety, compliance with the Americans with Disabilities Acts, the Family Medical Leave Act, the Fair Law Standards Act, and the Occupational Safety and Health Act. That's a mouthful, Jim. Do you have to repeat that on a regular basis?
Oh, I don't. I'm glad you're doing it, not me.
He consults with human resource and safety professionals regarding the drafting and implementations of employment and safety related policies and conducts supervisor training. Jim is a frequent speaker at seminars regarding numerous labor and employment law topics. He is active in the various chambers of commerce, human resource associations, safety councils, and contractor associations. So Jim, I will turn it over to you as with just a quick bit of housekeeping. Can you guys please all mute yourselves? If you have questions, feel free to drop them in the chat box or hold on to them at the end. So Jim, I'll turn it over to you.
Okay, thanks, Rachel. So things have been changing, as everyone knows, pretty quickly regarding COVID issues, regarding return to work issues, regarding, well, the big thing is what? Masking and social distancing now. So, I wanted to talk a little bit about those issues, masking, social distancing. What did the CDC's recent changes mean for us? What was the governor's reaction, and what does the expiration of Ohio's mandates, I guess the orders, or most of the orders on June 2nd mean for us in our workplaces? So I think the big news was when the CDC came out rather abruptly, I think surprised a lot of people, including OSHA and the EEOC, as well as employers, when they came out and said, well, we're going to decide that fully vaccinated individuals do not have to mask or social distance anymore, which was really a significant change from what we've been hearing from the CDC, and also from OSHA, and also some of the state orders that were out there, including Ohio's, and pretty much most states had some, and municipalities had orders out there. Certainly in Ohio, all the major cities had ordinances, masking ordinances out there, and the state had it. So in light of that, employers started grappling with what to do in our workplaces now, not only for our employees, but also for our customers if we're in retail business. So what did they do? So this was May 13th, the CDC came out and said, fully vaccinated individuals don't need to wear a mask or physically distance in any setting unless required by federal, state, or local laws or business rules. So then so we're talking about, what should we do with our businesses and policies and those types of things. And then Ohio reacted, as we'll see. There's some other things that the CDC didn't change, though. So CDC previously stated we're already going down this road a little bit, because fully vaccinated individuals did not have to quarantine at all if they were exposed to someone who was COVID positive. And the CDC had previously noted that individuals that actually were COVID positive also didn't have to quarantine so long as they were COVID positive within the 3-month period prior to being exposed. We haven't heard much more about individuals who were COVID positive and natural immunity and what that means for social distancing or masking. So right now we're just really focused, and the CDC is really focused on vaccines and vaccinated individuals. So in other words, businesses were already used to at least having to determine whether someone was fully vaccinated if a quarantine situation came up, if they were in close contact with somebody, and then a lot of our clients would approach the individual and say, okay, you're in close contact, we're doing, the Department of Health is doing contact tracing, we're going to need to quarantine you unless you're vaccinated. And then if that individual said they were vaccinated, some of our clients were actually having the individual certify just with an acknowledgement that, on such and such a date, I received my, final, in case of the one and done with the Johnson & Johnson vaccine, or my second, vaccination with Pfizer or Moderna. So then 2 weeks after that, then you're considered, quote, fully vaccinated. So those individuals didn't have to quarantine if they, certified that and acknowledged that they did receive the vaccine. So and the only reason I bring that up is because we're already kind of dealing with this issue in the workplace, on some workplaces, about trying to obtain some sort of, proof of vaccination, which is going to become even more critical now as to whether or not employers are going to want to go down that path. Okay, so this is right from the CDC, the new CDC guidance. So they had a little handy dandy chart for us, and on the right are fully vaccinated people, and look at all the things that they can do indoors now that not non-fully vaccinated people can't do, because on the left, they still have to wear a mask if they're unvaccinated. And the same thing with outdoor activities. So this graphic, again, is from the CDC's website when they came out with their recent guidance on what fully vaccinated people can do without masks. So, obviously, the CDC is still saying that if you're not vaccinated, you have to wear a mask to dine, even in an outdoor restaurant with people that are, other people that are unvaccinated, or attend a crowded event. Even outdoor activities, and of course, indoor activities, going back to that, if you're going to shopping center, unvaccinated people are still, according to CDC, required to wear masks. Also going to church or worship service, they still, according to CDC, have to wear masks if they're unvaccinated, and also eating in restaurants or bars. So that's the CDC's latest guidance. Now, I think OSHA was taken aback because, of course, the CDC is primarily in the business of giving advice to the public regarding infectious diseases. That's sort of their role in this pandemic. But they've been heavily, obviously, relied upon by everyone, from our governor to OSHA to pretty much everyone has been, most employers actually have been cross-referencing and following the CDC guidance. So just for a little bit of context here, at the end of January, OSHA had said it's important to wear a face covering and remain physically distant from coworkers and customers, even if you have been fully vaccinated. So now OSHA did also say that they were following the CDC guidance as well, and continuing to monitor that and relying on the CDC. So after the CDC issued their guidance, OSHA then made a change to its website, because after all, OSHA is who has, OSHA has the authority to regulate our workplaces. CDC is providing guidance, but OSHA, it has some enforcement power behind them, and to regulate employers and make them provide a safe workplace, right? So on May 17th, so it took them several days to digest what the CDC did. So on May 17th, they came out and said, okay, the CDC has issued this new guidance related to fully vaccinated individuals and mask wearing and social distancing. And we're reviewing that guidance, but in the meantime, we would refer you over to the CDC guidance for more information. So basically OSHA is saying it's okay if we follow the CDC guidance, you don't have to follow our guidance regarding mask wearing and social distancing that we had out there from January. So that's sort of OSHA's current pronouncement on the subject. So this is also what was in, I just want everyone to know that this was also in OSHA's end of January guidance that the president ordered in an executive order OSHA to come up with some guidance and a new standard. So they've been working on this new COVID emergency temporary standard, and I'll talk a little bit more about that, where we're at with that, where we think we're at with that in a little while. So OSHA was telling us at the end of January that we had to do all this employers had to do this laundry list of things, and obviously on there was employers were supposed to be furnishing and requiring face coverings and social distancing. So another interesting item that was in there that they recommended was to treat vaccinated employees and unvaccinated employees equally, except with respect to the quarantine guidance for fully vaccinated individuals that we just talked about. So this is still out there. OSHA didn't, they didn't get rid of this. They didn't rescind this. All they said is refer to the CDC regarding masking and social distancing guidance for fully vaccinated individuals. So this is still out there for employers to be doing for folks in the workplace. So, and remember, OSHA was supposed to have a new emergency temporary standard. The president ordered them to consider doing one, and they're supposed to have one done by March 15th. So they've blown past that deadline, and just within the last, on May 25th, the the National Federation for Retailers issued a letter to Congress urging them to not go down this path. So the National Retail Federation letter to Congress not go down this path of issuing a new emergency temporary standard regarding COVID, given the fact that the CDC is now saying, hey, fully vaccinated individuals don't really have to. We said they didn't have to quarantine before, and they don't have to social distance, and you don't have to wear a mask. So coming up with a new, quote, emergency standard now, 14 months after the pandemic started, and they're supposed to have an emergency standard that would bypass all the normal rulemaking processes that OSHA has. You would have to prove that there's a grave danger still out there that would require an emergency standard. So at least the National Retail Federation, as well as Republicans in Congress are now saying that there's no need for an emergency standard. And certainly since the CDC came out and said, as long as you're fully vaccinated, you can go and you don't have to wear a mask or social distance, go back to work. And both the Republicans in Congress and National Retail Federation, I'm sure there's going to be other associations, groups coming out and weighing in on this, are saying, well, you can't meet this legal burden of promulgating an emergency standard because there is no grave danger, and particularly since the CDC just issued this recent guidance. So we'll see if employers are going to have to, because a lot of what's on the screen would likely be included in this new emergency standard that employers would then have to implement COVID-19 prevention programs to the extent that their programs didn't include all of this. So we'll see if OSHA actually does come out with this emergency standard or not, and say you don't really need it. What OSHA did do was come out again pursuant to President Biden's executive order in January, after he was inaugurated. They did come out with a national emphasis program regarding COVID issue. So they're not requiring employers yet to hit. There's no COVID standard, but they are certainly targeting certain businesses, healthcare facilities, hospitals, but even construction, food, and manufacturing. So they have a national emphasis program, so OSHA could come out and inspect based upon this national emphasis program, just based on the fact that the employer is in the specific industry. So the national emphasis program is COVID related, but it's not, specific, a specific COVID standard. So this is what OSHA would come out pursuant to the national emphasis program. They'd come out and inspect and say, we have this national emphasis program. You showed up on a list. You were in these specific targeted industries, and let's see let's examine your records, see if you're actually keeping proper records regarding COVID related issues. Are you recording them if you're supposed to be recording them? Did you report them if you were supposed to report them? What kind of PPE are you providing? Are you following the respiratory protection standard? And all of these other standards, and also the general duty clause, which just requires that employers provide a workplace free from recognized hazards, even if there isn't a specific OSHA standard on point. So this is out there right now. So OSHA didn't rescind this, so it's still out there. So a lot of employers saw the CDC guidance and as a really hey, we're free, we don't have to wear masks, social distance, all these rules are going away on June 2nd in Ohio. But OSHA's national emphasis program is still out there. There's an emergency standard potentially in the works, and we do have previous OSHA guidance that has not been rescinded. So just a brief slide on record keeping. OSHA has said, as far as COVID cases, if you know someone is COVID positive in the workplace, you at least have to make some reasonable inquiries and try to discover whether or not it was work related, which obviously for most employers would be very, very difficult to do. But at least if you make a reasonable determination and decide that's not work related, and you keep that documentation, or that you couldn't make a decision one way or another, you don't have to then record it on your OSHA logs, on your OSHA 300 logs. Most of the recordable incidents of COVID are happening or happened in nursing homes, hospital facilities. Those types of places would generally would be much more likely to have to go through this analysis and come up with, looking at these, making a reasonable inquiry, and much more likely to have a recordable than an employer, let's say in a manufacturing facility. It'd be very difficult to tell that that individual contracted it, COVID at the workplace versus out and about in the community, given the high community spread that we were having before. So hopefully we don't have to make many of these calls anymore, because hopefully COVID is in the workplace is certainly on the wane, and the statistics are showing. The other thing that OSHA did that I want to caution the companies about is that they have now an emphasis program on retaliation. So they're really focused on employer, anti-retaliation programs, commitment to not retaliating. What does that mean? That means if people are complaining about workplace safety related to COVID, OSHA is looking for those types of complaints. And if people are complaining to OSHA, employers just cannot retaliate against individuals for making those types of complaints, even if those complaints are proved to have no merit at all. The employee is just a disgruntled employee, complaining about whatever they can complain about, and one of those happens to be a complaint to a government agency. So we can't retaliate against those employees, or OSHA will come out and actually investigate that.
Hey, Jim.
Yes.
We have a quick question before you move on too far. Katie says, to clarify, businesses in the National Emphasis Program should not be changing their COVID plan until OSHA comes forward with a new statement, correct? If OSHA is guiding businesses to CDC guidelines, would it be acceptable for vaccinated employees to no longer follow the National Emphasis Program?
Well, OSHA actually did come out and say we're going to follow the CDC guidelines regarding fully vaccinated individuals. So we're going to get to that certainly employers, and most employers, already have modified their COVID prevention programs in light of the CDC's guidance, in light of the governor's guidance. So yes, the answer is employers can certainly change certain aspects of those programs and plans, particularly for the fully vaccinated individuals, regarding social distancing and masking, and most employers are doing that, certainly. So the other change, and this was interesting, was that as far as OSHA just came out Friday, and this is regarding record keeping issues. Previously, OSHA took the position that if an employer made getting the vaccine mandatory, then any sort of side effects related to getting that vaccine would be work-related for purposes of OSHA record keeping. So you would have to put those side effects and the days away from the side effects, or any sort of restrictions someone had for the side effects for getting that vaccine, on your OSHA 300 logs. Just last Friday, OSHA took down their previous guidance on that and put this up. So this is right from the OSHA's website. So now, if even an employer that makes vaccines mandatory, if there's vaccine-related side effects, OSHA is saying you do not have to put those on your 300 logs, at least until May of next year, and then at which point they'll reevaluate it. So I thought that was very, very interesting. It showed that OSHA, stated that, look, we don't want to discourage employers' vaccine efforts, and so that if we want to encourage employers to encourage their employees to get the vaccine. So we don't want to do anything that would sort of disincentivize those efforts. So we're not going to make employers under any circumstances at this point put those vaccine related side effects on their OSHA log. So I thought that was interesting. So what did Ohio do after the CDC issued their guidance? Well, remember, the governor had previously come out and said on June 2nd, all of, well, I would say the large majority of Ohio's health orders related to COVID were going to be rescinded. And then the CDC came out and said, well, if you're fully vaccinated, you don't have to social distance or wear a mask. Well, that was contrary to what was existing, at least until, June 2nd, at least until June 1st. The order is rescinded as of 12:01 a.m. on June 2nd. So the governor, within a day, then came out and said, yep, we're going along with the CDC too. So you don't have to, if Ohio's orders previously required you to wear a mask and social distance, even if you're fully vaccinated, you don't have to do that anymore. We're going to go along with the CDC's guidance. And so, so that order came out on May 17th, and it just covers the period between May 17th and June 2nd. So that order was interesting in a number of respects. I threw up a couple of the key points that, businesses could certainly make the call, and this gets to our last question, to continue to require masking and social distancing among vaccinated and unvaccinated individuals if they want. So it's up to businesses. And it also, and I think this is a key point, persons not fully vaccinated could continue to wear masks indoors and outdoors if unable to socially distance, unless their activities fall within exceptions to the mask mandate. Basically, they have some health conditions that where they can't wear a mask, or an employer can prove that, that they can otherwise separate people, and it would be an exception. There's very few exceptions to that mask mandate. So clearly, unvaccinated individuals are still going to have to follow in Ohio's orders until January 2nd, and then the CDC guidance and OSHA's guidance thereafter. So the other aspect of that order that we're getting a lot of questions about is that the governor said, regardless of your vaccination status, individuals should still perform daily health assessments and stay home if you have a fever, cough, or other COVID symptoms. So that has been an Ohio order since I think it's last April, right? So we've been dealing with that for over a year. And the governor went and reiterated that. And then there's no capacity limitations for outdoor events if everyone's fully vaccinated. But if you're not fully vaccinated, then there's restrictions on, you can have people in pods of 10, and those pods have to socially distance. So there's restrictions. But again, that order is only in effect until June 2nd. It goes away except for group home facilities and healthcare workers, and those which were exceptions to the CDC guidance too. So public transportation, if you're getting on an airplane, if you're in a transportation hub, you still, even if you're fully vaccinated, have to wear a mask and social distance. And the governor is reiterating that. But all of these Ohio restrictions, besides the very specific restrictions about healthcare facilities and prisons, go away effective June 2nd. We've had a lot of questions about these daily health assessments. Okay, what does that mean as far as daily health assessments? Well, if you go back to the January OSHA guidance and also the current CDC guidance, they are that guidance also recommends, daily health assessments. Employers do not have to actually take employee temperatures. Employers jumped on some of these daily health assessment requirements and were proactive, and then had all of these temperature scanners throughout the facilities. And some people would have employees stopping at before they came into work at the card check and took their temperature and wrote it down and things like that. Many employers, given the recent CDC guidance, are reconsidering those types of health assessments at the facilities now, and are saying to employees that, yes, there's a requirement to perform daily health assessments. You can do those daily health assessments. We want you to do those on your own and stay home if you're sick. So you can do that, and you can modify your policies so you don't have to be doing all the temperature checking at various locations throughout the facility or before people come in. And so I think there's going to be probably more to come on that. So certainly once June 2nd comes, employers are going to be taking a long look at those aspects of their policies to see what we can, what we don't, what's mandated, what makes sense now. And a lot of employers have already modified those policies as far as symptom checking, just to tell employees to do it on their own. And the big thing is going to be with the, I think with masks and social distancing, and how we figure out, or if we want to figure out whether people are vaccinated or unvaccinated. So just really briefly, Michigan went and also modified their policies, their rules pursuant to the CDC guidance, but Michigan has its own state plan for OSHA, and they also have their own OSHA temporary their own COVID temporary standard. So they actually have a standard out there, unlike Ohio. So my OSHA has said that they're going to be updating that, but at least the governor has come out and said that they're going to get rid of the mask mandates for fully vaccinated individuals, indoors and outdoors, and mask mandates for everyone outdoors. And then, of course, different states treat this differently. So you have Florida with virtually no restrictions, and basically the governor of Florida saying municipalities can't even put restrictions on. So in Ohio, municipalities, according to Ohio's orders, the governor has always said that municipalities could have more restrictions than whatever the CDC has or OSHA has or an Ohio order has. They can make their own. So Indiana, mask advisory only, but the cities and counties like Indianapolis has one, can still require masks. So, and there's Kentucky, unvaccinated people must still wear masks indoors until June 3rd. So a lot of these states are actually getting rid of some of these mandates that they've had in place. Other states like Oregon and California, for instance, are basically saying you cannot, you still have to social distance or wear a mask unless you can prove that you are vaccinated. So California OSHA is requiring documentation of vaccination before individuals can not wear masks or social distancing. Oregon's similar to that. So depends on, and so states are sort of in flux of trying to catch up to the CDC guidance, and and all have, different rules and guidelines. Toledo, by the way, did the same thing that Ohio did last Thursday, when they went and said, yeah, we have this mask mandate, but we're going to conform to the CDC guidelines and also not require masks or social distancing for folks that are fully vaccinated. So you do have to sort of check your local municipalities to see if they've made a call on this one way or another, but most of them are just sort of getting around to catching up to CDC and Ohio on this. It didn't take businesses long to react to this at all.
Hey, Jim.
Yes.
Before you get too far, I have another question. So basically, if mandated by OSHA, is it accurate that the June 2nd rescinded health order doesn't apply and unvaccinated individuals will need to remain masked and socially distanced? So basically, if OSHA is still saying so, it doesn't matter what the governor says.
For unvaccinated,
individuals.
Yeah, and yes, and CDC says the same thing. So OSHA is saying employers should follow the CDC guidance with respect to vaccinated individuals, which is great, because then the CDC is saying if you're fully vaccinated, you don't have to wear a mask or social distance. But OSHA has never said that if you're not fully vaccinated, I mean, they still have that laundry list of things which includes, if you're not fully vaccinated, you should be masking and social distancing. And the CDC has always said that too. Both of them have been pretty consistent on that. So if you're a business and you jettison those social distancing and masking requirements for all of your employees, in my opinion, you're taking a risk, because OSHA is certainly saying that, and the CDC are saying that, our guidance is that you should be masking and socially distancing if you're unvaccinated. So I guess you could say, well, the CDC is not the boss of me and what's their authority, but OSHA really does have some authority, and they have a national emphasis program out there, and they could come out and say, well, we've had complaints from your employees about the employer getting rid of their masking and social distancing policy, and these employees are complaining that they know that there's people in the workplace that are unvaccinated, that aren't socially distancing and aren't wearing a mask, and are upset because the employer got rid of that, the masking and social distancing policy, and basically said no one has to do it. At that point, OSHA could come in and inspect and cite you at a minimum under the general duty clause for not providing a safe workplace for employees. So that's the risk that's out there. And so now we've set up a situation that I'll get into a little bit, where you have this dichotomy between the vaccinated and unvaccinated, and you still have the CDC and OSHA guidance out there, and we don't know what OSHA is doing as far as the standard emergency standard goes. But so Walmart, Costco, Target, Trader Joe's, Starbucks, they eliminated their mask mandates for employees and customers. But remember, in Ohio, on June 2nd, Ohio's mandates go away, but that doesn't mean that the CDC guidance isn't still out there, or that OSHA's guidance isn't still out there. So this is the vaccine dashboard as of yesterday. So in Ohio, they update this on a pretty a daily basis. So 45% of the population has at least started getting vaccines. So, and that in the 70 to 74-year-old category of over 82% of those individuals have been vaccinated. So and the vaccines are just starting to get rolled out with for the younger folks. So that's where the most of the unvaccinated are. So, so what do we do as far as these vaccines and proof of vaccines and all of that? Really, some, fundamental questions are, can employers require a vaccine? And the answer to that, the legal answer to that is yes, with some exceptions. And those exceptions are someone could have a health related reason why their physician is recommending that they don't get the vaccine. So they would be, covered basically under the ADA, and you can't force somebody to get a vaccine if, they have a health reason or disability related reason for not getting the vaccine, or if someone has a genuinely held religious belief where that would prohibit them from getting a vaccine. So you have to make religious accommodations, and you have to make accommodations for folks with disabilities, even if you mandate the vaccine. So you could mandate it, but that you would have to make exceptions and accommodations for certain folks. So this is the big issue now is, okay, what do we do if, what kind of documentation, what kind of proof could we or should we require? Oh, by the way, on mandatory vaccines, there's hardly any employers out there that are making a mandatory, but for employers that are sort of in the healthcare setting, employers that would normally make the flu shot every year mandatory, healthcare workers, nursing homes, places like that are making vaccine mandatory for the most part, but not about other employers are making it mandatory. Most employers are encouraging their employees and providing incentives to get the vaccine. So if employers want to get people back to work and open back up again, sort of get back to as much normalcy as we can, a lot of employers are taking surveys of their employees and asking, have you gotten the vaccine yet? And that's okay. And even the EEOC says that is not a medical inquiry, so it's not invasive. You can actually ask employees if they have the vaccine. So the problem then, it gets a little dicier when you want sort of proof of the vaccine. What kinds of proof can we get? Can we ask employees to show us their card, their vaccine card? Yes, we can legally do that. What about getting a copy of it? Well, typically, most employers now are not keeping copies of that, and you have to keep that in sort of a special area. Now you have that documentation. And then you can't make these follow-up inquiries. Well, if you haven't gotten the vaccine yet, why not? Those become prohibited questions according to the EEOC, and they get into someone's health status, and you don't want to ask those follow-up questions if you're an employer. But you can mandate the vaccine. Most employers aren't doing that. You can encourage people to get the vaccine. Most employers are doing that. You can ask if they've gotten the vaccine. You could take a survey. You can ask employees to certify or acknowledge that they got the vaccine and what the last date was, so you can tell when they were fully vaccinated for purposes of having them not quarantine and not social distance or mask. So employers are doing all of that right now. Can you offer incentives to vaccinate? Well, yes. How much of an incentive we don't know, but heck, we know that the state of Ohio is giving away 4-year college scholarships to the younger individuals that have been vaccinated, and $1 million. We just had our first drawing this week to folks that aren't of college age. So yeah, we could give incentives. Who pays for it? The vaccines are free, and time off to get vaccinated. Most employers are providing time off to employees, paid time off, as an incentive to get vaccinated. And if there's adverse reactions, if you mandate it, we don't have to put it on the OSHA logs anymore. If there's an adverse reaction, it may be a compensable. If you mandate it, may be compensable under Ohio's workers' comp system. So now some of these big issues that we're dealing with are, what are we going to do as far as our masking and social distance policies now? We can certainly revise them for fully vaccinated individuals, and a lot of employers in Ohio have done that already. Simply, sending out a notice saying that if you're fully vaccinated, you do not have to wear a mask or social distance as of now, right? So what about our symptom checking policies? We talked about that a little bit. As an employer, you can say, we expect you to follow the CDC guidance on symptom checking and continue to check your symptoms and make sure you don't come into work if you're sick. So what about the masking and social distance policies that we talked a little bit about for the unvaccinated? Well, this is where sort of the rubber hits the road. We've created a situation where we don't know what OSHA is going to do with the new standard. There's some uncertainties out there. There still could be some local ordinances that we may have to deal with. And so businesses that have operations in different states are having a hard time with coming up with sort of one policy that fits for all of its employees. And if we, and from an HR perspective, we really don't want to say, okay, you come into the office on Monday or come into the office on June 2nd, and it's a whole different ball game because Ohio's rules aren't in effect anymore. And the fully vaccinated go to one side and the other unvaccinated go to another side. And they're sort of pitting the fully vaccinated and the unvaccinated against each other. That's not good HR policy. And it might have some legal implications too, because if you're differentiating in terms of job duties or job functions between fully vaccinated and unvaccinated, and those unvaccinated individuals are unvaccinated because of religious reasons or because of disability related reasons, you could have some legal exposure there by treating those individuals differently. Again, if you make if you inquire too much into an individual's vaccination status, you could be running afoul of the ADA, the GINA, the Genetic Information on Discrimination Act. That makes information that we know about an individual's family member protected health information. So we don't want that and that information either. And then of course, Title VII with folks with disabilities or religious accommodations, we could be running afoul of OSHA. Remember, they told us at the end of January that we should be treating vaccinated and unvaccinated individuals the same. If people are complaining on behalf of themselves and others regarding masking issues, that certain individuals aren't masked, they feel unsafe, and that we know that that person is unvaccinated, you could run into that's protected. Those complaints could be protected concerted activity under the National Labor Relations Act, whether you have a union or not, which would then prohibit an employer from taking any sort of action against the complainers. And of course, you could have union issues if you do have unions by individuals that are wanting everyone to be masked, or know that some of these individuals that are unmasked haven't gotten the vaccine. They could be complaining about safety issues and filing grievances over it. And the unions could be filing unfair labor practices over certain policies that could affect their, certainly their working conditions, and or if you're implementing certain policies without, talking to them, that could have some ramifications with your unions too. So there's a lot of moving parts if you're treating the vaccinated and unvaccinated different. And then what this is going to put an employer in the position of is being on the one end of the continuum, the quote mask police, where if someone's not wearing a mask, we have to check to see if they're vaccinated. How do we check? Well, we're going to get documentation from them, and we're going to get their copies of their card, and we're going to keep it on file, and we're going to be, our HR folks are going to be busy, our HR and our safety folks are going to be busy mask checking to make sure they're fully vaccinated. And I don't know of any employer that has talked to me since the CDC revisions that said they really want to do that. The employers are saying, we don't want to be the mask police. And on the other end of the continuum is the honor system. Hey, there's been some changes. You don't have to wear a mask or social distance if you're fully vaccinated. We're 100% on the honor system. We expect you to be, employees to be responsible. And for those of you that aren't fully vaccinated, you still have to follow the CDC guidance, mask, social distance. Everyone should remain safe. No one should come in if they're sick. And then there's a lot of space in between. So maybe you don't want to be the mask police, but then if somebody actually comes and complains and they have information that the person that's working right next to them is unvaccinated, and they're saying, screw it, I'm not going to wear a mask, then maybe the in-between position is that you confirm that individual, hey, we heard that you're not wearing a mask and following these policies. Are you fully vaccinated? And if so, if they say yes, say, well, can we see your card, or can you sign this saying that I'm fully vaccinated, my last shot was on such and such a date? Is an employee really going to risk their job to not wear a mask, to lie about not wearing the mask? I would say most of the times no, but we're all dealing with some crazy workers out there sometimes. So most employers don't want to be the mask police, but these are the tough issues that you're going to have to deal with in your workplace. So just a few more slides, and then I'll see if we can have time for some questions. But as far as trends for time off, of course, California and New York are giving folks, California, you get 2 weeks worth of leave for anything that's COVID related, and a paid leave. And then New York is, each vaccine people are getting 4 hours pursuant to a state mandate. Most employers are doing that kind of stuff voluntarily. Our COVID claims, workers' comp claims, they could be, COVID could be compensable, but usually we're talking about, I think 80% of the claims, the compensable COVID-19 claims, are really for first responders, healthcare facilities, nursing homes. Most other types of COVID positives are not compensable. There's a very high threshold for a workers' comp claimant to show that COVID would be compensable under Ohio's system for sure. So, hey, we ran through all that stuff pretty quickly. I I think there's a lot more to come with CDC, certainly with OSHA, because OSHA is now under a lot of heat to not promulgate a new standard. So, so we're going to have to see what happens there. And the EEOC has yet to weigh in after the CDC's guidance to see if that affects their guidance on how they deal with folks, you know, how we deal with folks in our workplaces with disabilities or needing religious accommodations vis-a-vis the new guidance regarding fully vaccinated individuals. And they haven't, so they're going to issue something, I would assume, within the next week, couple weeks, on how that would affect their guidance. So a lot of things up in the air. Bottom line is, at this point, you know, June 2nd is going to be a new day in Ohio because the statewide health mandates go away regarding COVID, but you still have CDC and OSHA guidance. And at least for the fully vaccinated, they don't have to wear masks or social distances, and most employers are not requiring those individuals to wear masks or social distance in accordance with the CDC guidance. So I think there's a lot more to come, but I don't, if I'm an employer, I want to take a little bit more of a cautious approach. I'm not going to rip up my COVID prevention programs and policies just yet, but I may be modifying them, particularly for the fully vaccinated. Rachel, do we have anything else out there?
I don't see anything in the chat. If anybody has any questions, you guys can drop them in the chat real quick, or feel free to unmute yourself. We'll get a couple questions in before we cut it off for the morning.
Yeah, we're at like 59 minutes right now.
Yep.
So, but you know, certainly interesting times and more to come. I always give the disclaimer that, you know, what we're talking about is current as of probably this morning. And it may very well change by the end of the day today.
Well, if things change, you guys all, I hope you all wrote down Jim's contact info. That way things change tonight and then again tomorrow at 8 a.m. you can get clarification, because I don't think we're out of the woods with the changes that happen on an almost weekly basis quite yet. So I don't hear any questions. So real quick, I'll give you guys a couple upcoming chamber events before we log off. Monday, June 7th is our next Mastering Monday. It is conflict management with Jeremy Pollock from Pollock Peace Building Systems out of Washington, D.C. And then on Friday, June 18th, we are having our in-person ag breakfast. So at Old Zims, so you guys can come get breakfast. You can register for both of those events at scchamber.org/events. So thanks again, Jim. Thanks for everybody who joined us. And I will be sending out the recording of this to everybody who registered. So if you missed something or you need to take some more notes, I've got it for you.
Thank you.
All right. Thanks,
Have a great day,
everyone.
everyone.